Hello, welcome back to the channel. Here we're gonna do one more of those Q&A things that we do sometimes. It's pretty important because these are questions that we get from patients, from salon stylists and everything. So it's nice to have these interactive videos. Of course, this is not live, it was recorded, but you'll see here there's a question from a stylist. We're gonna answer that, okay? So stay tuned. Hey there, so let's talk about the question from Raphael about menopause. So here's the question here.
Hi, Dr. Barusco. So I have a question for you. My name is Raphael. I work here at Bis M Salon, and I have a lot of clients that have very brittle, dry hair that are starting off in menopause, and it's just causing their collagen to fall out and just things of that sort. So I was wondering if you had any opinions, any help that you could give us to help, restore their hair back to what it was before they started.
All right, thanks Raphael for the question. We get this every day here at the office, very common concern. Women going through menopause, either perimenopause, which is that initial phase where the periods start to get really irregular, they're not sure, they're approaching 50 years old. And also women that have gone through that already are in full menopause. That means they're not having any more menstrual periods, and they may be having the symptoms like the hot flashes and whatever like that. But a common question I get is how, their hair is changing now. So what happens in menopause, just a brief overview. Normally women have estrogen, progesterone, testosterone, androgen hormones. Those are the male hormones. Estrogen and progesterone are the main female hormones. So those are, the estrogen particularly is produced by the ovaries and also peripherally through the peripheral tissue. When menopause happens, the estrogen level drops drastically, and with that, women have the symptoms of, hot flashes, and they have the irregular periods as well. The drastic drop in estrogen is not accompanied by the same sharp drop in testosterone. So testosterone also drops in women, but at a much lower rate. And because of that imbalance, there's a relative predominance now of the testosterone versus the estrogen, so it's not balanced anymore. And if the woman has the traditional female pattern hair loss, androgenetic alopecia as we call it, then that excess testosterone, which is relative, is not the numbers that go up, but it's just the imbalance, can actually trigger more hair thinning and acceleration of that. Also, they can go through a process called telogen effluvium, which is a rapid shedding of hair that can be caused by many factors, but also menopause is one of them. So what do? We counsel them to do some basic hair care. I usually tell patients that we have to address two things. The root of the hair, which is under the skin, that's an area that shampoos and things like that will not reach normally. And then there's the outside hair, the hair shaft, which was what we comb and style and what you see there, Raphael. So for the hair shaft, I recommend usually being gentle with products, using sulfate-free products, paraben-free products. If they're going to apply color, I usually try to get them to get a color that's not so aggressive, a little bit more delicate, and not do it as often. As you know, if you go from dark to light, you have to strip pigment from the hair. That's always more aggressive than doing the opposite. If you are going from light to dark, you're actually infusing color in the hair shaft. So it's a little bit more user-friendly for the hair that way. But women can still enjoy their hair styles and everything like that. But infusions of keratin and proteins to the hair, hydration of the hair are very important. That can help minimize the damage. The roots of the hair, they're treated through medications, and there's a variety of them. Usually we use combinations of medications. So I'm not going to really talk specifics here because I need to see the patient. This is done in a case-by-case basis, So, but what I would tell them if I were you when they ask you questions is, okay, look, go for, we'll treat your hair here, we'll do some hydration, things like that. But you also need to address the roots, which is then with a physician that specializes in hair loss. As you know, we offer free consultations. I'll be happy to see these clients for you and kind of put them on the right path, so that way they'll have better hair for you to work with and they'll be happier too. Other things need to be investigated sometimes. A lot of times women have also low thyroid or hypothyroidism, hyperthyroidism, anemia, other deficiencies that need to be addressed also to get the hair to look the best. So all these things I will investigate here at the office, and then we will communicate. The patient will have better hair for you to take care of, okay? So in a very short answer, this is kind of what I would recommend, so treat the hair the best you can, try to be a little gentle with the products and stuff like that, and then send them to us so we can do the part that you can't do, which is the root treatment, which involves usually pills and things like that. So I hope that was helpful. I'm here, I'm available to questions and everything. If you're watching the video, if you have questions about these things or other topics, you can record a video like Raphael did and send it to us. Or you can send us in the comments below and I can try to answer them for you, okay? So thanks again, Raphael, for the question. It was great, and I'll see you next time.